Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert. And today we are going to explore very much how much is too much when it comes to surgery. With me, Dr. Millicent Rovelo, as always. How
Always
are you?
a pleasure. Good. How are you?
Doing good. How are you?
I'm doing all right.
All right, good. That's important because that's really the key to this podcast, isn't it?
It is. How good are you?
That's right, because a lot of people want to do a lot of surgery at one time if they can,
Yes.
but everybody wants it to be safe.
Yes. And that is the key. How much is too much? And there is a limit, and it has a lot of variables, and it's very dependent. So let's go through that because I think it's a pretty common question. You know, you have patients that come in, classic mommy makeover, right? Everyone's like, well, what's a mommy makeover? Mommy makeover is really anything you want it to be, but usually it's for the postpartum mom who's had a couple babies, has breastfed, and has seen the changes of pregnancy and breastfeeding on their body. So usually it's some kind of breast and tummy combination. It can be breast, tummy, labiaplasty. It could be breast and liposuction. It can be any number of things. There's no set menu per se for that. But
Really, because it sounded like a combo number 5 to me.
Sometimes it's combo number 7.
That's right,
You know, it's like, choose your flavor.
That's right.
But it's some set combination of procedures done to rejuvenate the post-mommy body.
Definitely.
And so that's sort of the most common things that we see. And those patients typically come in with a very set idea of what they want. I want my breast done. I want my tummy done. I need this. I need that.
But how
much
long are those operations,
is too
Dr.
much?
Rovelo?
Those are long operations. Those are 8-hour operations.
They're all-day suckers.
Easy. And I think the name of the procedure is misleading because it's so cute, right? It's like it's a mommy makeover. It's like a spa day. Like it's, girls' day. Mommy makeover, so cute.
No, it's maximally
And then
invasive
you come
surgery.
in and you get told how long the surgery is going to be. And more importantly, you get handed the price quote. And all of a sudden,
It
it's
ain't
not
cheap.
so cute anymore.
No, that's right.
I've had
It's-
a couple of girlfriends across the country call me and be like, "Is that really how much this costs?" I'm like, "Girl, you're getting like 2+, 3+ procedures. Yes, it's expensive."
Oh, no, it's about to get real in the Roxbury Clinic and Surgery Center with those price quotes.
Yes, so it's not cheap, but that's not the point. The point is, you can combine surgeries. And so sometimes patients come in and they say, that I want a mommy makeover. This is what I want. But more frequently, what I get is they come in for a tummy tuck, and we talk through it. And like, okay, that sounds good. That's what I want. Oh, by the way,
Hey,
while
Doc.
you're there, oh, hey, doc,
That's what I call that.
can we do this? And so we go through that. Okay, well, what about this? Okay, what about this? And then that's when we have to get to the topic of okay, slow your roll. How much is too much?
Yeah, and so it depends where you're operating, number one.
Yes.
Depends on whom you're operating on. And it
Yes.
depends on what the procedures are in terms of the potential risks that you're dealing with. And I will tell you that time, to me, is the biggest factor. The amount of time.
100%. It's time in the OR.
Right. I think that once a procedure's at 7 and 8 hours, you're done. I think it's just, that's where the complication profile for things like easy for me to say, pulmonary embolism and infection start to go up really rapidly.
Significantly.
It's a curve that all of a sudden it's like, there it is.
Yeah, and it's not to say that if you have a surgery that's over 8 hours, you're going to have an infection. It's not that cut
but
and dry.
your risks go
but
up.
the risk of having a complication does go up because the longer you're under anesthesia, the more exposed you are, especially if it's a big body case and you're doing multiple body parts, your body gets cold. And it's weird to think that your body can get that cold from just being in an OR, but those ORs are usually set to 65, 66 degrees. I'm cold and I'm wearing gowns and gloves. I don't know why these ORs have to be so cold. That's a hospital thing. But even though we try and temperature regulate the patients, we put warm bear hugger, which is like these warming blankets on them. If you have large areas of your skin naked and exposed for 8 hours, your body temperature is going to drop. And when your body temperature drops, that is when you have problems with infections, with wound healing, with systemic issues such as bleeding, because your body needs to stay at a certain core temperature. So
right, and you also have the ability of your cellular immune system starts to not be as functional. So
Right.
that's why I'm telling you, I'm all about you have to know how long these things take you. as a surgeon.
Yeah.
You know how long a augmastopexy takes you. I know how long it takes me.
Right.
I know how long a revision rhinoplasty takes me, versus doing a primary like I know those things. And as a surgeon, you have to be realistic with yourself about how long these things take, because you want to provide total safety profiles that are sensible and reasonable for your patients for aesthetic surgery.
Right.
You don't want to be risking their lives over, oh, we got to get all this done in one shot. I don't have any time to heal. I've only got these 2 weeks. Too bad.
You got to keep it safe. And I am with you 100% in that it's time in the OR. My cutoff is about probably 8-9 hours is where I'm like, okay, after that, it's too much. We got to change up something here. So that is what I base my, cutoff factor on. Patients start going, oh, hey, what about this? And what about that? The other thing that comes into play is what areas of the body are you working on? So if someone comes in and says, I want bilateral arm lifts and bilateral thigh lifts, well, that just took out 4 out of your 4 extremities. Like, you need something that functions on you, or even a tummy tuck with an arm lift. Well, how are you going to get out of bed? How are you going to get out of a chair when you have no core and no arms? So these are things that, like, you have to sort of think about, what is your recovery going to be like if you choose to combine certain kinds of procedures? So it's the type of procedures, it's the length of time in the OR, and then probably very importantly, it's the health of the patient.
Yeah. That's why we get pre-op clearances on anybody that's basically over 40. We're sending them for...
Yep. I get them on my 18. I get them on everyone. I just don't...
Yeah, it's good because you got to check if they have any problems, see if they've got heart problems or whatever. Right. You want some other set of eyes other than your own. We are plastic surgeons. We
are not medical doctors.
No, we're not. And
we pretend. We pretend a lot like we are, like we know what we're talking about, because we do. We are doctors.
We do know, but it's not our focus.
It's not what we do every day.
If people could understand how focused, it's the difference between somebody that flies a Cessna, a small little single prop engine versus somebody who flies an F-16. If you fly the F-16 all the time, the Cessna's all of a sudden seems pretty simple, but you're not flying it all the time. So if there's a problem, you might have an issue. But if you fly the F-16 all the time, then you're good to go with that. So you have to understand that your wheelhouse is your wheelhouse, and somebody else has to do something else.
Absolutely.
So we get other eyes on our patients that really help us in a tremendous way, and they see things that we aren't necessarily looking for.
Yeah.
We're just not. Yeah. We're not.
Who knew? Who knew that was there?
I don't know the latest antihypertensive medications, the latest ARB or what. I don't, and I'm not the guy to be like, oh, you should be on this one or that one.
I don't know if your hypertension is controlled. I don't check your blood pressure when you come to my office.
Yeah.
So things like that, and then, that's because the issue is, the more unhealthy you are, the more limited your surgeries are going to be. If you're someone with a known history of having heart attacks or strokes, or if you're on, a lot of blood pressure medications, or if you're a diabetic, I'm going to be a lot more hesitant about doing big, major surgeries with long OR times, because the longer you're under anesthesia, the longer your risk of anesthesia complications, such as heart attack and strokes.
Yeah.
So if that's something that you're prone to, then I'm going to limit what I do.
Definitely. And it's fine. You just have to kind of say, okay, I get it. And you don't want to put yourself in a situation that you're taking unnecessary risk for aesthetics. It doesn't make sense.
Or for convenience, for post-op convenience.
It doesn't make any sense.
It doesn't make any sense.
No.
And probably one of the most common things that I get, questions for that, with regards to just surgery in general, is, am I too old for surgery? I had a patient today that I saw who was very much a, oh, by the way, and an oh, while you're there. And she started asking, well, how long is this going to take? And I was like, 6, 7, 8 hours. But I was okay with that in her. And she said, oh, is that safe? I'm 62 years old. Looking at her medical history, no medical problems, not on any medications, healthy as a fiddle, normal BMI. And I said, yes, we actually know that age is not necessarily on its own a factor in your complication profile, provided you're healthy. Because you can be a very healthy 62-year-old who will do much better than an incredibly unhealthy 40-year-old. Maybe the 40-year-old's overweight or has diabetes or high blood pressure. There are other variables that are important, and age by itself is not a contraindication to having procedures.
So let me ask you a scenario that just came up for me, and I want to get your opinion on this because I think it'd be kind of cool to hear. I have a patient who is coming for augmastopexy revision. She has implants in, and then having basically liposuction of arms, back, bra fat, abdomen, thighs, like the whole deal.
Mm-hmm. Full body lipo.
Right. And the question from her physician is it safer to do it in 2 operations? She's 36 years old with absolutely no medical problems. Healthy as they come. Works out all the time. In good shape, just a little bit, wants to contour things.
Yeah.
So the question is, should I do the breast separate from the lipo?
In someone like that, it comes down to time in the OR and how much fat you're going to be removing. And someone that's a pretty normal weight, just has a few areas she wants to contour.
Probably 4,000 cc's, 5,000 cc's max, but maybe not even that much.
Yeah, that's fine. If you can do all of that under your kind of 7-8 hour limit, she'll be fine. Will she be in a world of pain? Yes.
Here's the very distinct question is it safer to break it into 2?
Is it safer?
And I
don't know.
I want to know what you think.
Is
it safer?
I don't think that it is because, where are you going to see the risk come in after
it's going to take me 6 hours to do that operation.
Yeah. So you break it up in 2, and now you have 2 intubations. Now you have 2 extubations. This is where the scary part of anesthesia comes. Anesthesiologists like to say our job is 95% boring and 5% sheer terror. And that sheer terror usually comes when they're trying to intubate or extubate. So if you're otherwise healthy and you can tolerate from a physiologic standpoint 6 hours of surgery, it makes sense to just have 1 intubation and extubation. And
by the way, that's what I said.
Yeah.
I said I cannot draw on any particular data point that would tell me that you should break this into 2 because it's safer.
No, I don't think that at all. I think in a healthy patient, there is data that says surgery of at least up to 6 hours is perfectly safe in terms of your anesthesia complications.
And I drew on your point exactly that 2 intubations versus 1 for the same risk profile. Why would you not just do it at once?
Why would you do 1? And then, of course, the question that we mentioned briefly here is convenience, right? If you're taking the time off from work and you're already putting yourself under a set time of recovery, it makes sense if there's multiple areas that you want to address and you have the financial means to do it all. Then, yeah, of course, combining everything makes sense because it's 1 recovery, it's 1 time off from work. So that's where I think combining surgeries makes sense. If you want to combine them to save yourself the recovery and your time off from work, and it's safe to do so, and you're a healthy person, and it's not going to take 12, 13 hours, then combining surgery is safe.
Yeah, and I agree. I mean, you have to just think it through. The only thing that I did say about doing multiple procedures versus splitting it into 2 is that it would be easier recovery to do the breasts and then do the lipo, probably by a week on each side. But now you have 2 kind of recoveries.
Right.
So it's like, I really try to break it down for my patients when they ask me those questions, and I really want to think it through because, you don't want to just kind of willy-nilly say, oh, now just do it all together. Well, maybe you shouldn't do it all together. Maybe you should break it down. Maybe if you have diabetes and you're not that healthy, that maybe you should do 2.
Maybe you should.
Because that prolonged procedure could put you at higher risk.
It is a problem. And the other thing you have to factor in when you are looking at full body procedures like that, where you're working all over the body, is how are they going to recover? Because we really, really need our patients to get up and move after surgery. Because moving diminishes your chance of having blood clots. It diminishes your chance of getting complications from pneumonia and breathing issues. Getting up and moving after surgery is so important that is why we send our patients to aftercares. It's why we ask them to spend the extra money, because we know that if they go somewhere for that first night after surgery, there will be nurses that will make them get up and walk with them, because walking is so important. But if you are in a world of hurt and you don't want to get up and move, well, that's not helpful either.
Yeah. No, I mean, that's why you have to gauge your patient and really try to custom tailor the treatment plan for every patient. There's no set moves for anybody. It really is a discussion and an exploration every time we do a consultation about what's going to be best for this person.
Right. Agreed.
Well, I think we kind of nailed it. You have anything more on that, Dr. Rovelo?
No, that's it.
Well, then this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.